Hi, Becky. Nice to meet you.
Lovely to meet you too.
Hi. Lovely to meet you.
Hi. We got you a cup of tea.
Thank you very much.
You have been so busy. I can't believe you've even made it here today.
It's been a crazy couple of weeks.
Yeah.
It really has.
Tell me about it then.
So it started off with Rachel Bland, who's the BBC journalist who sadly died of breast cancer. I knew her and talked to her a lot, and she obviously died a couple of weeks ago. The day after she died, I became step granny, which is fantastic. But the day after that, I had my ovaries out as part of my treatment for recurrent breast cancer, meaning I could never have children. And then I had a statue unveiled, which was amazing. And then the book launch. It's just been a crazy whirlwind of PR.
Well, that whirlwind is exactly it,
Yeah.
isn't it? How are you managing to cope with it all? Or is it a nice distraction?
It's a lovely distraction. I don't think I've really dealt with my cancer coming back, and keeping busy just really helps me, give me something to focus on. But I think there will be time in the next couple of months where it will all start to sink in.
Well, let's talk about the book then, because this is what you've spent all weekend reading, isn't it, really?
Thank you. Amazing.
So, why? I mean, I know that you started to write a blog when you first found out, but what prompted that?
It was a way of coping. I was in denial. I knew too much when I found out. Like most patients, you were drip-fed information. You'd have found out that you have a lump, and then you get the results, and then do you need surgery, do you need chemo? When I saw my scan, I knew everything. I knew what the next 10 years had in hold. And I think writing was a way of me coping, but also helping people. Because I'm a doctor, it's all I want to do, and I was looking at 9 months home alone on the sofa, and by blogging and helping healthcare professionals and patients know what it's like in safe, friendly terms, I thought I can do a little bit of good. And the co-author, Professor Trisha Greenhouse, she DM'd me on Twitter. No one knew she had cancer, but she was having cancer on the same day as me, and we became online chemo buddies, just that sense of support. And as doctors, we realise there's so much that patients don't know, or they don't take in, or they don't know where to go for help. And we just thought if we can put everything in one place where they can dip in and out, it might help people get a bit of understanding about what's happening to them.
So you've been put in an incredible position, really, with all this knowledge as a consultant, and then suddenly to be on the other. It must have felt very strange for you to have been the person that was always giving the news, then to receive. Did it make you more prepared, do you think?
No. I thought I knew what it was like to look after patients with cancer, and I think I was good at doing it. But I've never had the scans, I've never had the surgery, I've never had to decide, do you have a breast reconstruction? And as a doctor, you have no idea what patients go through. You tell them what will happen, but you can't tell them how to cope because you've never had it. And I suddenly realised what all my patients feel like. And it was using the information I've gleaned to help doctors look after patients better as well.
What did you think of the book, Maria?
Oh, it's amazing. I wish I had it 18 years ago. I didn't want to read any leaflets or anything. Basically, I put them in the bin, but your book is incredible.
Thank you.
I read it out loud to my husband yesterday because we were driving to Ipswich. So I was reading it to him, and it was just, we were both in tears because you can relate. I related to everything that you were saying and talking about, and Trish as well. But it's just incredible. I think everybody should read it.
Thank you.
Definitely, because, you know, mothers, sisters, friends, it will actually help everybody. You know, I'll read it, I'm going to keep it and read it again and again and refer to it, you know, if people are diagnosed. And
thank you. That means
it's just
a lot.
incredible. It really is, yeah.
Who did you have in mind when you wrote it?
Initially it was patients, but we also wanted friends and family to understand what it's like to be a woman when you lose your breasts, you gain weight, the infertility, the difficulties of dealing with sex, how can you discuss that? And I think it's very hard for family to understand what it's like when you have cancer. They can't because they've never had it. And if reading that gives them an insight to help them look after the people they love, then we're helping everybody, not just the patients.
Yeah, definitely.
I think as well, because you were both very young when you got breast
you were
cancer.
40 as well.
I was 37.
37, I was
so I'm
40.
55 now, so I was 37.
Yeah.
Yeah.
And both fit and healthy.
Yes,
and,
yeah.
And I used to run marathons, didn't you?
Yeah,
so,
and triathlons, yeah.
Yeah, and it's almost, it doesn't discriminate, does it? You can't,
No.
And you must have known that actually as a consultant anyway.
Yes, so we know the biggest reason women get breast cancer is being older and being a woman, and it's lifetime exposure to hormones. And we know that being overweight and not exercising can increase your risk, but it can happen to anybody. And it's really hard to think, why me? Why did I get it? Is it my fault? And it never is.
Did you ever fall into that trap and start feeling that yourself, or did you?
No.
Did you listen to your own advice that you've given over the years and think, this is how I'm going to have to be strong about this?
I knew enough to know it wasn't my fault. I was terrified of having chemo and how that would make me, and I was terrified of it coming back. And suddenly you're looking at your life being put on hold thinking, who am I, what happens next, where do I go? And you just have to go through month by month. You must have done with chemo and your surgery.
Yeah.
It is a new normal, it's a new
and-
future, and you have no idea. I didn't think I'd be writing a book 3 years ago.
So you're obviously a very successful consultant. You were successful business lady. Now you have a different business.
I do.
I want to come to the hotel and get the dog.
Dresses from dresses to dogs.
Will you let Cocker Spaniel in?
I've had Cocker Spaniels in,
Okay.
yes. No, that can go to my neighbours.
Okay.
But you were both... Sorry, go on, Maria.
I was just wanted to say, when I was reading your story,
Yeah.
I can't remember which page it's on now, but you were talking about chemotherapy, and you described your chemotherapy feeling exactly the same as I did, and having the worst hangover from hell,
Yes.
but no alcohol, and
Yeah.
that's what I say to everybody, you know, because you can joke about it, but that's how I felt. You know, I was sick, I didn't want to eat, and I just felt I had a massive hangover.
Yeah.
And that's exactly what you said, you know, and it's true. And
So my oncologist told me it's a bit like drinking a bottle of gin a night for 5 nights without dancing on the tables, telling people you love them.
Yeah.
It's that kind
And
of...
it is, yeah. But you get over that.
You
don't
do.
You? You do, yeah.
Did you decide that this is what people needed to hear, or because you'd been through it yourself?
I think part of it was we wanted to help people live after they finish cancer treatment. A lot of the time you're told you're alive, your breasts look great, off you go, but there's so much more to it. The sex, the infertility, body image issues, and also the whole diet and exercise. There are so many snake oil treatments out there, turmeric or kale juicing or vitamin C enemas in Mexico, and the public don't know what's right and wrong or what's going to help. And we just wanted to help them understand the evidence. If something is quoted in a tabloid as saying this will cure cancer, we'll just step back and see, is it something you really want to do? Just because there's so much wrong information out there. And as a patient, you're desperate and you don't know who to trust.
Did you go down any of those routes? No.
No. I'm all for people using complementary and alternative therapies, but together with normal medicine.
Right.
I think if these diets and juices worked, we'd give them for free on the NHS. But I've never been at that point of having metastatic cancer, knowing there's no cure, desperate for control. And I can't judge people who want to do it. But you don't want them spending hundreds of thousands of pounds travelling to Japan and Mexico, and it doesn't work, and then they then come back to see me as a doctor, and we're left to pick up the pieces, and it's really, really hard.
You're both incredibly successful women. Do you feel that people view you differently once you've had cancer? Did you find that maybe friends treated you in a different way?
Yeah. Some again, going back to the book, you had a whole paragraph on there about people, how their reactions are to you.
Yeah.
And, you know, I always used to say to people, do not cross the road. You know, I haven't got 2 heads and 3 nipples. You know, I've got cancer. My son had just started, my youngest son was 4, so he just started school. You know, so I was the gossip at the school gate. And I knew I was, because people would be like, oh, here she comes. And I'd be like, hi, it's me, you know. I'm here, you know, I'm just going to get on with it and just talk to me about it. So people did view, and I had a different view on life. You know, I left my job then and went out and did something completely different, you know, and it was about me. I wanted to be kinder to myself, but it's the support and it, you know, the network of people, and you know who your friends are, definitely.
Yes.
They don't know what to say, do they? You know, you just...
We're not taught at school how to talk about cancer,
no.
or how to help people.
No.
Do you think we should be?
Yeah, I do.
Yes, definitely.
Like Greg Wise has recently been saying on the Back of the You, Me and Big C podcast, you need to talk about death and dying. People die, you don't lose loved ones, they don't slip away. It happens to everybody. And cancer is happening to almost 1 in 2 people in the UK. I think we should start talking about it at schools in safe, friendly terms, so it does become part of normal language.
I mean, let's talk specifically about language then. There's a lot of people now saying it's not a battle that someone lost. And do you think that the language needs to change?
Yeah, I personally hate the battle fighting technology. You can't win the cancer battle. You have to wait to see if medical science will help cure you. And if you die because of cancer, it's because medical science wasn't there to treat you. And it's not something you choose to go into. soldiers go into battle out of choice, knowing they might die or live, but you don't choose to get cancer, it happens to you. I think you can fight to stay strong, you can fight to stay healthy and look after your body, but you don't have a say whether you live or die from cancer. But the press love that whole, she lost the battle, and it just makes you feel like you're a loser. I didn't try hard enough. People are trying every day to stay strong and live as long as they need, but it's the medical research that is losing the battle, not us. What do you think about?
Yeah, I totally agree, yeah.
Did you feel that, how did your husband cope when you were told that you had cancer?
When I was diagnosed?
Yeah, was there enough there
He coped for me.
Did he?
Yeah, because it basically went over my head. I knew that I was a grade 3 and it was small and it was aggressive. That's all I heard. And the rest, you know, he was my eyes and my ears, so...
It's almost like you're looking down on yourself from a distance, floating, because you can't cope with what's going on down below.
Yeah, it's exactly. But your book relates to everything, and it's simple to understand. And there is some doctor, you know, you've even said in there about the medical speech, the medical...
Kind of the jargon we use.
Yes, yes.
Yeah.
And there is some in there, but it's very simple to understand because you're going through it. So, you know, it's just so...
I mean, when I looked through it, I was... and, you know, my mum had breast cancer and I feel like I know a lot about it, but actually I realised I knew nothing. And some of the pictures, I'm like, wow, okay.
The surgery's changed an awful lot regarding lumpectomies and reconstruction and saving women's breasts. It is amazing what we can do now.
Yeah.
You've held nothing back, really, in writing this book, have you?
No.
Nothing.
I just wanted to make sure it's a source for everybody, and not just people like us with primary cancer, but people with metastatic cancer. Women need to know what to look out for because it can come back 10 or 20 years down the line.
Yeah.
We just wanted to be the one place where you can go, you can dip in and out of when you're ready to as well.
Yeah. It's like the perfect mix of a consultant and a friend, someone who has your best interests, but also, you know, emotionally and professionally. Yeah, you've done very well.
Thank you.
Tell me about, you recently, you mentioned that you had your ovaries removed.
Yes.
And that's a preventative measure. You've decided to do that.
Yeah. So my breast cancer came back when I was taking tamoxifen, which lowers your hormonal levels. And I needed to move to another drug, but I had to be menopausal for that. And that either meant a monthly injection in my tummy of an implant to switch my ovaries off, or an operation to have them removed. And I thought an operation is quicker than having potentially 3 years of injections.
Right. You make it sound like, you know, that was
me. I'm talking about myself as a
weighing
patient.
it up.
It's weird. You kind of distance yourself from that.
I can see that. But that
It's
might
hard.
have helped.
It's hard dealing with the infertility.
Yeah.
And I was probably never going to have children, but this wasn't my choice. It was taken away from me because of cancer, and that makes it hard to deal with. But if it keeps me alive, I'm all for it.
You do seem incredibly strong, actually, both of you have that in common. Were you like that before?
No.
No.
I honestly don't know where this inner strength has come from.
Really?
But I think one of the problems is, because I'm strong and powerful, I'm talking about exercise and diet and doing all of this, it's very hard for me to show the vulnerable side. The days when you are crying in the shower or you have a headache and think, oh my God, has it come back? And I think it's important to almost let the public in and say, it's not all amazing smiles and wonderful. We all have our vulnerable days, and actually show that, to show the reality. We're not Wonder Women. We're just coping the best we can. Well, we are Wonder Women.
I would say you are.